Hello everyone, welcome back to the channel once again. I hope you all are doing good. So basically in today's video we will be covering the second part of Introduction to Anatomy and Physiology, where we will be covering one specific topic called directional terms. If you ask me why one separate video for this specific topic, it is basically because the concept that you will be studying or the topic that you will be studying today, it is going to be little confusing, little difficult, but at the same time it is very important for you to understand these things very properly. Now how this video is going to be very important for you, one more reason is that whatever things that I would be discussing or telling you guys today will be something that you cannot get or understand in your colleges or in your schools or in your institutes, maybe because usually people don't give that much of priority to these concepts. And as a biomedical engineer, these concepts are very important for you to have a good understanding on, because when you're collaboratively working with doctors or healthcare professionals, it becomes very important for you to maybe understand these things and communicate with them very effectively using the understanding that you have in the specific topic, right? So without further ado, let's dive into the video. Okay, so I believe you can see the screen. Now, first of all, what we will be doing is we will be summarizing what we have covered in the last video. Summarizing it quickly, we firstly saw introduction, basically understanding the difference between anatomy and physiology. Then we understood the history of anatomy and physiology, how exactly these two concepts came into existence. Post that, we saw physiology, how different parts are functioning with each other to maintain the internal balance inside the body, which is called homeostasis. Post that, we saw complementarity of structures and functions. Basically, different body parts will have different shape and size. Why is it so? So that they can perform their functions very effectively. And post that, we saw hierarchy of organizations, which is basically meaning a group of cell will contribute or make a tissue, a group of tissue will be making an organ, a group of organ will be making an organ system, and the organ system entirely together contributes to the body, the human body. Now today what we will be seeing is basically the directional terms that we use to represent different body parts. Now let's understand this with a real life example. Let's say you're going to a doctor and you're having a stomach pain, right? And as you visit the clinic, the doctor would probably ask you where exactly it is paining. Now you don't know the medical terminologies that you should be using to tell where exactly the pain is, because we are laymen, we don't know how to do that. But on the other hand, if you look from the doctor's perspective, they understand the different positions that are there inside the body, through which they can understand where exactly it is paining in your stomach, and accordingly they will be referring it to the other doctors if required, or they will be prescribing you the medicines accordingly. So how exactly we do this, right? So over the period of time, anatomy has developed its own standardized set of directional terms. So I have highlighted it here, that described where one body parts is in relation to the other. So now let's understand this with an example. Now let's say your stomach. Now you have to denote a position that is above your stomach and below your collarbone, right? How exactly you will refer to that position? So to refer these positions, right, with respect to the different body parts in relation with each other, you use directional terms to understand the different body parts and its positions. Now let's start with this. Now imagine a person standing in front of you. You can imagine or you can look at this picture that you see. It's a skeleton, right? Quite funny. Now a person, when he's standing erect, facing straight ahead with the right arms at the side and palms forward. So as you can see in this image, a straight body standing erect, facing towards the front, palms or hands are outside, stretched towards the outer side, facing, palms may be facing in the front side. Now this is a classic example of anatomical position. So I will highlight it here. It is the classic anatomical position that you denote with, so basically whenever you are meeting a doctor or anyone, they make you lie down in a stretcher or things like that, right? Now why exactly they do this? So that your body is in the classic anatomical position. Your body is straight, erect, facing right ahead, and your palms stretched out towards the outer side. Now imagine slicing this person from the center, right? You will get a right half and a left half. Now when you are dissecting this body from the center, like you see in this image, from top to bottom, from the center you are dividing the body into right half and the left half. That is called sagittal plane or median plane, right? Then what is parasagittal plane? Now once you have the right half and the left half, if you are again dissecting it towards the outer end, then it would be known as parasagittal plane. So if you can see this image, firstly we divided the body from the center, that is denoted by the yellow line. Now when you do that, you will get the right half and the left half. Now let's say again you are dissecting the same body again from top to bottom towards the outer side. It is called the parasagittal plane. So if you can see this pink, it is on the left hand side and it is again dissecting the body from the center. So it will be called parasagittal plane. Okay. Now coming to the next part, the coronal or frontal plane. Basically when a person is standing, if you take classic anatomical position, a person standing straight, and if you are dividing that individual vertically, which is like this, okay, vertically from top to bottom, what will happen? Your body will open into two halves, right? The first half or the front facing part would be known as the frontal plane or the coronal plane. On the other hand, the horizontal plane that you basically get, that is of the back side of the body, you will be calling it as dorsal plane. I will be covering that with an image as well. Now when you are dissecting the body from top to bottom vertically, it is known as coronal plane or frontal plane. And when you do that horizontally, when you are dividing the body horizontally from the center, which is like this, if you can see this image, from the center I am dividing the body, it will be known as transverse plane or horizontal plane. Now what will happen when you do this? You will get an upper half and a lower half, right? Now again we denote that in two different terms. What is it? The axial and the perpendicular parts. What is an axial part? Axial part is basically the parts which are above the body, that is basically consisting of head, neck and trunk. If you can see this image, the green highlighted structure would be consisting of the axial part. Now when you are dividing the body from the center horizontally, which is somewhere here, all the parts that are above, which will be in alignment with the center line of the body, is known as the axial parts. And what are the appendicular parts? The parts which are in the bottom or the parts which are stretched outside towards the body, which is basically the arms and the legs. So when you are dividing a body from the center horizontally, you will be getting upper half, lower half. Upper half is known as axial plane, lower half is known as appendicular plane. What will axial plane consist of? Head, neck and trunk, and appendicular will be consisting of arms and legs. Again, as I was telling, when you are dividing the body vertically, right, you will be getting a front side and the back side of the body. The front side is known as the anterior or ventral part of the body, and the posterior or the back side of the body is known as dorsal or posterior. So in simple words, if you are dissecting the body from the center vertically, you will get the front side and the back side. The front side is known as frontal, ventricle or anterior. On the other hand, the back side is basically known as posterior, dorsal or back of the body. Okay, let's understand this as an example. I'm sitting right now facing the camera. So which will be the frontal part or the anterior or the ventral part of the body? My eyes, my nose and pretty much things like that. What will be the posterior part of the body? Basically it can be my buttocks. It can be considered as the posterior side or the back side of the body. I hope that helps to get you some idea. Now when you are using directional terms to refer the exact position of the body, right, there are two types of denominations that you use. Featuring towards the top of your body, like your head, is considered as superior or cranial, and while the structures that are on the lower down are basically known as the inferior. So basically, now let's say if you have to denote something that is on the top part of the body, you will be denoting it as superior or cranial. On the other hand, if you have to denote something that is on the lower side of the body, you will be denoting it as inferior or caudal. So I will help you understand this with a classic example. Okay, let's take this example, right? So the jaw is superior to the lungs because it's above them, while pelvis is inferior to the stomach because it's below them. Now if you can see this image, where is jaw? Jaw is here, right? What is below the jaw? basically your lungs or your rib cage, right? Now if I take with reference to the lungs, where is my jaw? It is superior to the lungs, which is above the lungs. On the other hand, if I see my pelvis bone, which is basically this one, where is it located? Stomach will be here, it will be below the stomach, so I will be denoting it as it is inferior to the stomach, which is basically below the stomach. So that's how you differentiate superior and inferior, and it will differ from the different use cases in which you are using these terms to denote different positions. And there's even more. Now this is something that is really interesting. Now there are axes that you use to represent or maybe give denominations of different body parts, right? Now if you imagine the center line running down the axis of a body, structure towards that midline are called medial, right? So now if you can see the skeleton, from the center I am dividing the body. I'm not actually dividing, I am just taking an axis from the center of the body, which is from top to bottom. So all the organs or structures which are very close to this line will be known as medial. Right now, let's say lungs position will be medial, heart's position will be medial, stomach's position will be medial, kidneys will be in the medial axis. So all these organs which are very close to the center part of the body or the central line or the midline of the body, you will be denoting it as medial. On the other hand, if you see that arms, right, both the arms, if you can see the second picture that is there, both the arms are stretched outwards, right? It is very far. Now if you can see the center line and if you can see the fingers, they are very far away from the central line or the medial line, right? So how you will denote that? You will be denoting that as lateral, right, which is farther away from the midline. So what else can be lateral? Maybe your toes can be lateral, your knees can be lateral, your arms or elbows can be lateral. So all these things that are farther away from the medial axis or the medial line or the midline is known as lateral. Now again, this lateral, to denote this lateral, right, now again if I consider this as the center part, which is the elbow, again there are two segments that I will be getting. So how will I denote a body part, that body structure that is here or a structure that is farther away from that? Let's understand that as well. So to denote that, we basically have two kind of differentiations. So if you see the clavicle or maybe let's say shoulder bone, whatever is very close to the shoulder bone, you will denote them as proximal, which is towards the trunk or towards the shoulder or towards the clavicle. On the other hand, whatever is farther away from the clavicle or whatever is farther away from the trunk, you will be denoting it as distal. So if you consider this arm, here is the elbow, right? The elbow would be here. Now whatever is coming before the elbow, it is obviously going to be near the trunk, and I will denote them as proximal. On the other hand, if you can take example of these fingers, right, they are very far away from the trunk. So this half, whatever is there after the elbow, I would be considering it as distal. So I believe you understood what is proximal and what is distal, right? Now let's take a quiz, right? Now imagine you go to a restaurant or I go to a restaurant, right, and I'm having a sandwich and it had a small piece of toothpick which I didn't notice and I swallowed it by mistake. Now I'm feeling very uneasy. I go to the doctor and he's asking for, let's say, what exactly is the position where to look for. So basically he takes an x-ray, and once he finds the x-ray, he saw where the toothpick is. But now since I have to go for the surgery, they should denote that specific position in anatomical terms or directional terms. So again, read the question. A fragment of the toothpick gets lodged somewhere in here, okay? Now because when I'm eating something, everything should be above the stomach, so it will be somewhere here, and my doctor takes an x-ray and says that I need a surgery, like I mentioned. Now using anatomical language, how would she or he direct the surgeon to that tiny piece of toothpick that I have swallowed inside of me, right? So you can pause the video, take a notebook and a pen, go to the previous things that we have discussed and understand how exactly you will be denoting this. And if you want any help, I am here to help you out with the solution. Pause the video and maybe try doing it. Okay, now let's look at the answer, right? Now the first thing that you have to understand is whenever you eat something, it is always going to be towards my central axis of the body, which is the medial line. So the first thing that we will be denoting here is it is along the medial line. Now if I'm eating something, it will come in this axis only, right? Because it will eventually go to the stomach, and stomach is in the medial line of the body, so it is along the medial line. Then second thing what we will see, where exactly we can find it. Now what exactly is the position of your food pipe which is leading to the stomach? The food pipe is going to be behind the heart, which is basically posterior to the heart, but it is going to be before the spine or before the vertebrae, right? So how exactly you will be denoting it? Anterior to the vertebrae. So along the medial line, which is the center part of the body, it is going to be behind the heart, which is basically posterior to the heart, and it is going to be before the vertebrae, it is going to be anterior to the vertebrae, right? So 3 differentiations we have done. What will we see next? We will be seeing next where exactly is the position, upper part or the lower part, right? Now it is going to be inferior to the collarbone. Now when I am eating something, obviously it will go below the collarbone, right? So I will denote it as inferior to the collarbone. So if you see this image, this is the collarbone, and whatever I am going to eat, it is going to be coming inferior to the collarbone or below the collarbone, right? Basically if something that is below the collarbone, and if I have to denote it, that is, it is going to be above the stomach, how exactly will I denote it? As I said, superior to the stomach. Inferior means down, superior means up. So let's summarize it again, right? Along the medial line, which is going to be the central axis of the body, because when I'm eating something, it is going to be staying towards the central line of my body. Posterior to the heart, which is going to be behind the heart. Anterior to the vertebrae, before the vertebrae. Inferior to the collarbone, and superior to the stomach. So if you are getting confused between posterior to heart and anterior to vertebrae, I'll explain it right now. Let's consider this is the heart and this is the vertebrae. So there is a space that is there in between these two, right? And there exactly maybe your foot pipe would be passing through. So how exactly will I denote this? It is basically posterior to the heart, which is behind the heart, and it is anterior to the vertebrae, which is before the vertebrae. So it will be somewhere here in the central line, right? Now that is the position that we are trying to mention here. Along the medial line, posterior to the heart, anterior to the vertebrae, inferior to the collarbone, and above the stomach. And that would give an exact idea, right, where to look for this. So now tell me which organ is there in this position. Something that is below the collarbone, above the stomach, behind the heart, and before the vertebrae. Absolutely correct, right? It's going to be the esophagus. So now this is the place where I can mark an approximation to maybe find this toothpick, because when I'm getting the X-ray, I can get an idea, and with this approximation, the surgeon can easily do the surgery and take out the toothpick, right? So now that's how you basically denote the different terms, directional terms, or you refer to these directional terms when you're talking with respect to the different positions of the body. So quickly summarizing it again, I will not go in deep, but we will just see and highlight the main important parts. First thing, a standing erect body facing straight, palms stretched outside is going to be the classic anatomical position. Now when you are dividing the body from top to bottom and you are getting a right half and a left half, it is called as sagittal plane. If you are further dividing the sagittal plane by from top to bottom, it is going to be known as parasagittal plane. And what is the coronal plane? Coronal plane, when you are dividing the body from top to bottom and opening it into two halves, the front part and the back part, the front part or the frontal plane or the front side of the body is known as the coronal plane. If you are dividing the body from top to bottom from the center horizontally, it is going to give you upper half and lower half, and this division or dissection is going to be known as transverse plane. Now what will be the upper part and what will be the lower part? The upper part is going to be the axial, whereas the lower part is going to be the appendicular. What all body parts would be considered in axial? The head, neck and the trunk. Whatever is going to be in the lower part of the appendicular part, it is going to be known as arms or legs, right? Anterior and posterior. What is anterior? Whatever is in the front side of the body is anterior. Whatever is in the back side of the body is known as posterior. Anterior is also known as ventral. Posterior is also known as dorsal. So you can remember either one of them, either anterior posterior or ventral dorsal. Then what is superior and inferior? If I have to denote something that is on the upper part of the body, I will be telling it as superior. If I have to denote something that is on the bottom part of the body, I will be denoting it as inferior. What is medial face and lateral face? Medial means basically whatever body part is in organs in alignment with the central line of the body, will be denoting it as medial. Whatever is towards the outer side of the body, you will be denoting it as lateral. Now if you break down lateral, there are two divisions, two directional terms that you get. Whatever is towards the trunk, or whatever is towards the shoulder, or whatever is towards the clavicle, you will be denoting it as proximal, and whatever is farther away from the shoulder bone or the clavicle, you will be denoting it as distal. So again, you can see the image. Proximal is near to the shoulder and distal is farther away from the shoulder. So that was a quick summary, and with that we are done with the directional terms, and also we are officially done with the first module. Summarizing quickly what all we have covered: we started with anatomy, understood what is anatomy and physiology, and then we understood the different structures and the body parts. Then we understood complementarity of structure and function, why different body parts or organs have different structures and how exactly it is helping them to work very efficiently. After that, we saw hierarchy of organizations, where we covered and understood that a group of cell will be making a tissue, a group of tissue will be making an organ, a group of organ will be making an organ system, and a group of organ system, or basically an organ system, contributes to the human body. After that, we saw homeostasis. What is homeostasis? Quickly summarizing it: the ability of the body to maintain the internal stability of inside the body is going to be known as homeostasis. To be alive, the body has to maintain internal conditions very stable, and that is exactly known as homeostasis. If someone is dying off, the internal conditions vary very drastically, and because of which the person eventually dies. And then we saw finally the directional terms, in which we understood how different body positions inside the body can be denoted when dealing with any medical conditions or treatments or whatsoever may be the reason. Okay, so that's about it. I believe the topic was little confusing, but I made sure to maybe explain it to you in the most easiest way possible. And if you have any doubts, or if you have any questions, or if you have any queries, please feel free to drop in the comment section, and maybe you can comment down your queries. I will revert back to the comments as soon as possible. If not that, in the description there is a link to my LinkedIn profile. There is link to the WhatsApp chat community, where you can directly speak to me whenever you want to through that WhatsApp channel. And also, I would be giving the notes for the same in the description, so that you can go to the drive, open it, download the PDF, and maybe learn from that as well. So I'll see you in the next video and we will be starting off with the second module. Till then, stay safe, stay home, study well, and just grow together.